on over at Blount Memorial. Morning, Mike.
There we go. Well, November is American Diabetes Month, and so we're joined this morning by Angie Tillman from Blount Memorial, sharing 4 keys to successfully managing diabetes. Good morning to you.
Good morning.
I know a lot of people that have diabetes, and it's tough to manage it.
It really is, and it's sort of an increasing epidemic. We see the numbers going up. 30 million Americans have diabetes right now, and it's estimated that about 86 million have pre-diabetes, which means if you have pre-diabetes, your chance of developing diabetes in the next few years is very high.
Okay.
So there's even an estimate that says in 2050, possibly up to 1 out of every 3 Americans will be diagnosed with diabetes in 2050.
Why?
So not that far away. So type 2 diabetes is what 90 to 95% of diabetes cases are, and type 2 diabetes is what we're seeing the rise in, and a lot of it is related to lifestyle. We definitely see there's some impacts that you can have with maintaining a healthy weight, getting physical activity that can delay or really reduce your risk of developing type 2 diabetes specifically.
Interesting. So it's really, and it goes back. We talk all the time about this. It's about what you put in your mouth.
It is. It's about, making healthier choices, being more active. So, but once you get that diagnosis of diabetes, it can be really scary. People are overwhelmed. They don't really know where to start. So, I encourage them to take a deep breath, sit back and relax, and focus on 4 main things.
Because it's a total life changer.
It really can be. And really it can be a good thing. I see many of my patients who find out they have diabetes and they end up making a few changes, and they can have a much healthier life because it sort of gets their attention. Okay, I need to do some things a little bit healthier.
Okay, let's talk about these 4 keys.
Number 1, know your numbers. You want to know what your blood sugar numbers are and what your A1C number is. Your A1C is sort of a 3-month average of your blood sugars, and most doctors are going to be testing that. So it really helps for patients to be educated. What should those numbers be? And let me be paying attention to that. Ask the doctor, ask questions. How often should I be monitoring my blood sugar at home? Because that's where you get feedback on whether some of the changes that you're doing are working or
Especially people who are new.
Absolutely.
Right,
absolutely. When you're new.
But even anybody, right?
Anyone who has diabetes, you want to know what those numbers are.
Okay.
Number 2, you want to pay attention to the carbohydrate that you eat. So when we eat foods, we eat carbohydrate, protein, and fat. The biggest thing that impacts blood glucose levels is the carbohydrate. It matters how much and what kind. So you don't have to cut all carbs out, but obviously less of the unhealthy processed high sugar carbs and more of the healthy stuff, vegetables, fruits, some grains, some starchy vegetables, some great things like sweet potatoes and winter squash, those kinds of things. So some carbohydrate balance throughout the day, and really sit down with a dietitian or a diabetes educator that can help you learn that individually, because it varies for each person.
And I will have to say, we found out that from our insurance here, check your insurance, because there are dietitians that actually will take it, and some insurance companies will cover it in full.
And with diabetes specifically, we see that very commonly.
Yeah,
so there's help out there.
Don't be afraid
sure.
to call your insurance
Don't be
company.
afraid to ask some
Okay.
questions.
Number
3, more physical activity. Being more physically active burns the blood sugar. It forces your body to use that glucose in our cells, in our muscle cells. So work up to at least 150 minutes a week. Now, for some people, that you can start today. For some people, that's a big stretch. It may be starting with a 5-minute walk to your mailbox and back, and gradually building up. But it is one of the long-term keys. It has an immediate effect, and then the more often you do it, it has a lasting effect.
And I think you hit the nail on the head. You got to gradually get there if you're not typically in the best physical shape, because you can't just try to go all in.
Start where you are.
Otherwise, it's not going to work. Number 4.
And number 4, reach out for help. There's dietitians, certified diabetes educators out there. Sometimes it can seem overwhelming. You're sitting down, you're Googling stuff, and it's like hard to figure out what to really do. We can sit down with you and really talk to someone about making it simple and easy and something they can do in real life.
Perfect. Angie Tillman, Blount Memorial, thank you so much for those 4 great tips. 8:21 now, the airline offering new luxurious cabins. Have you seen this yet? And how much it'll cost you? Angie, I don't think we're flying on this one. We'll be right back.